Dr. Vincent Reid, Medical Director of Mercy's Halpern Cancer Center, joins us now. And Dr. Reid, we'd heard about the delays in cancer screenings during the pandemic, even screenings dropping as much as 94% during the height. Can you tell us, are you continuing to see this trend in declining screenings locally here in Cedar Rapids?
I think we're starting to see some improvement in those trends. Obviously, as you stated before, there were significant decreases and delays in screening, and even some services were not screening at all for some time during the height of the pandemic. So those delays, I don't think we'll know what the final impact of those delays will be for some time, but we're already starting to see some anecdotal data that those delays will lead to some adverse outcomes for some of our patients, unfortunately.
And can you talk, do you think those will be more long-term, short-term effects of those impacts and effects of those delayed cancer screenings?
I think some of those could certainly be long-term impacts. If, for example, you're looking at individuals who are presenting with more advanced diseases because of delayed in diagnosis and delays in screening, I think presenting at a later stage for most cancers changes survival. So from that standpoint, I think you're looking at some potential long-term impacts. But again, that's, in five or so years, we will have a better idea as to what the exact impact is. But the anecdotal data so far does suggest that the delays that we saw at the end of the pandemic will have some negative impacts.
The American Cancer Society initiated a campaign called the Get Screened Initiative aimed at increasing screening rates. Can you tell us about that and its effectiveness? That
initiative actually has a lot to do with trying to get low-income populations and people with less access to continue to get screened. As you know, access and screening essentially is at times very, very linked to economic status. And then that affects certain populations more adversely than others. So that's an initiative to kind of encourage screening in whatever ways you can, and to get individuals to get the kind of screening that we recommend for colon cancer, breast cancer, cervical cancer, and all the other kinds of cancer. Because as we've stated before, when cancer presents at an earlier stage, the survival is better, and the treatments are less onerous at times.
And at the Halpern Cancer Center just celebrated National Cancer Survivors Day. Why is that important to focus on survivorship?
Oh, I like to say that I wake up every day trying to create a survivor, right? And so I think that is a very, very important initiative. It gives us an opportunity to kind of reflect on the journey a lot of our patients have taken. I mean, some of these individuals have been through a very rough journey. People have had surgery, radiation, chemotherapy, that has taken a toll on these individuals, and not only a toll on the patients themselves, but a toll on their loved ones and their care providers. And so I think it's an important thing to reflect on that journey, and it shows a sense of accomplishment for the patients, certainly, and for the treating providers. It also gives other individuals a clear picture that with the appropriate treatment and the appropriate care, you can get there, that survivorship is possible, that if you have cancer, it's not the end, provided that you receive the appropriate treatment to the extent that you can tolerate that treatment. So I think for all of those reasons, celebrating survivorship is an important part of what we do.